Hello everyone, I am Dr. Shankar Dey. Welcome to my channel. This is 14th video of NEET-PG recall session discussion. So 14th video. Please subscribe my channel Dr. Shankar Dey for all the questions asked in NEET-PG 2021. This question contains question number 181, 161 to 80. So starting with question number 161. So this is me actually, Dr. Shankar, and this was my medal. And so starting with question number 161, point source of light brightness international standard. Among the options given, the answer will be candela. So the answer is candela for the question. Candela is the international standard for point source of light brightness. Next, coming to the next question, question number 162. I think this question was very long with a very big chart in post Diwali stage of Delhi. So Delhi, post Diwali stage of Delhi. So I think they have asked what is the degree of pollution on something 23rd, date 23rd degree of pollution was asked, and air pollution index on date 23rd November was 407. So this comes under category of severe air pollution. Severe, whenever the air pollution index is between 401 to 500, it is called severe air pollution. So Delhi is in severe air pollution on post Diwali stage. Next, 163 question number. A baby of 16 months of age came for checkup in, I think, in Anganwadi, and the Anganwadi worker measured the body weight. It comes 6 kg, and these two values are plotted on the graph WHO weight age graph, and it and the question asked what is the next step for this baby. I think the graph was in between two standard deviation and three standard deviation. So this is nothing but moderate. The graph was in between moderate and in between the line in between two standard and three standard. So it will be moderate malnutrition. So moderate malnutrition, just tell me, am I right or not in the comment section? Moderate malnutrition. So only one option was given about moderate malnutrition, and the step is counseling of mother about how to feed. So I think this will be the correct option for the question, moderate malnutrition. So if you have answered this question in the last NEET-PG examination, do comment in the answer section whether the point was within the range of two standard to three standard deviation, means moderate malnutrition or not. So because many national level faculties are discussing something else regarding this question, so do comment. According to me, I think this is moderate malnutrition, and the correct step will be counseling of mother how to feed. This was given in the option 1. Next, question number 164. I think the blast furnace or something, worker labor in the blast furnace, or some thir some thermal station. So there was history of exposure of heat, high degree temperature. Then there is also history of loss of consciousness, poor target of skin. And the question asks what will be absent in this patient. What sign and symptoms will be absent? Sweating will be absent in this patient, heat stroke patient. Sweating. So this is the answer. Sweating. Next, another, I think others options are like tachypnea, hypotension, cold clammy skin. So among the four options given in the exam, I think sweating is the best possible answer for this question. So next question was a patient of angina complaining chest pain, relieved by GTN or nitroglycerin spray. ECG was showing left ventricular hypertrophy and T wave changes. though troponin T level was normal. The question asks what is the next best step. I think this question is also controversial because national level faculties are making this question controversial because mm, they some faculties some faculties telling this is this the next best step is intravenous GTN, but I think according to me the best option will be increase the dose of metoprolol. I may be wrong, just do comment in the comment section what you have done in the last exam. Increase the dose of beta blocker metoprolol. I think other options are like subcutaneous enoxaparin or clopidogrel or GTN. Three options are there. I think these are wrong. This is the correct answer. But do uh, comment on the comment section because some faculties are telling GTN is the best option. But I think increase dose of metoprolol is maybe best option for this question. Next question number 166. A patient of pancreatitis imaging, radiological imaging shows pancreas bulky fluid collection. What is the most common enzyme likely to be elevated? This is, I think, this is lipase. Lipase, most commonly associated finding, lipase. So next 167, one patient of known TB CT image was given. So on the CT image there is in the midline there is vertebral column, then on the lateral side of vertebral column on bulky structure muscle like structure was marked as A, and other structures also marks B, C, D, but I am least bothered about B, C, D because the answer lies in the options A. This is nothing but psoas major muscle. So psoas major muscle, paravertical present, just present just by the side of the vertebra. This muscle is psoas. This muscle is psoas major muscle. So the patient was complaining of pain, and there was excruciating pain on there was, and the position of the limb was in flexion and medial rotation, the affected part. I think this is the complications following TB. This paraverticular abscess, this may be psoas abscess. So in this case, the affected part is this A. So the answer is A. The CT image was given, and the answer is, I think, probable answer is A. Next, 168. Image-based question was there. Actually, the image was about washerman's feet. The image of 2 feet was given of a dead man that and the feet was sodden white in color, blunt sodden white. So there are, so I think this is nothing but washerman's feet, and what may be the probable cause of this washerman feet? Immersion for last how many time? I think 36 hours was given. So immersion in water more than 36 hours, more than 36 hours. This is the best possible option for this question. So I know my image is very bad, but this was the image. 2 feet of a cadaver showing was showing washerman's feet sign. So this the correct answer will be immersion in water for more than 36 hours. Next, coming to question number 169. Patient of RTA stable Follis after Follis catheterization is was showing hematuria. Bruise is also present on the flank or lateral aspect of the abdomen. Investigation, I think CT scan was their option, so CCT will be best for this patient. So CT scan. Next, another question, similar type question was there. Injury, fall from cycle, then blood at tip of meatus was seen. Next procedure. I think many options are there like RGU, suprapubic catheterization, Follis catheterization, anything like that. Options are there. Sorry, not suprapubic, not RGU. Here the options are like I think. Suprapubic catheterization, SPC, or Follis catheterization. These are the option. I think in this case the option is suprapubic catheterization is the best option for this patient. I may be wrong. Just do comment in the comment section whether am I right or not. Another question was about sodium deficit. A 70 kg man with sodium 120. Just tell me what is the answer. I don't know. Actually, I forgot how to calculate this deficit. So just comment in the comment section. Those who have seen other faculties video, please comment. Next, question number 172. Ectopic pregnancy, 6 weeks, 3 centimeter in size, no cardiac movements, beta HCG high, and the best possible management. This is also controversial because some faculties are saying this is methotrexate, but as the question was best management was the question, and some faculties are telling this is salpingectomy. So controversial, again controversial, salpingectomy. So there is controversy between these two options. So what you have done, just do comment in the comment section. I think methotrexate can be the best answer. Salpingectomy also according to some national level faculties. So as the question was about best, not the possible management. So just do comment. Question number 173. CRF patient, chronic renal failure patient, dialysis, and he or she has not undergone dialysis for last I think 1 or 2 weeks. ECG is showing 12, 10, 8 TS, and the question was about what is the pH changes or ABG findings. I think this will cause acidosis. The option was like something 7.1, and PCO2 in this case will be less because of tachypnea, and also there will be less bicarbonate. I think this is the possible option was some. I think B option will be the correct option among the options. When just do comment in the comment section what you have done in the exam. So I think possible answer is B for the question. Like pH decreased, PCO2 also decreased, bicarbonate is decreased uh, following absence of dialysis for last 1 week in a chronic renal failure patient showing ECG tall 10 TEF T waves, hyperkalemia. Next question number 174. Therapist emotional needs. This therapist emotional needs and the question asked was what is that term, or what is the term that means therapist emotional needs. I think the question was about counter transference. So counter transference is the best possible. So exact language that was given in the exam, uh, just form the question. What was the exact language that was given in the exam? Do comment in the comment section. But as far I remember, the question was about this counter transference, and the hints given were therapist emotional needs. Question number 175. A, I think we have one female patient with over familiarity, hallucination, excessive talkativeness. What is the diagnosis? Straightforward question, nothing but mania. I think all of you have done this question right. This is mania. Question number 176. I think this question was about hand washing. A teacher teaches students about steps of hand washing, then the student go home and practice it perfectly, and the mechanism of this was asked. So this was also controversial. Some teachers are saying this is psychomotor, and some teachers are telling this is the mechanism is something else. Just do comment in the comment section. Then question number 177. Formal thought disorder. This is the derailment. The correct option will be derailment. Next, question number 178. Angiogram image was there. As far as remember, there was image of aorta, then common iliac, then internal external iliac very much compressed, and there is less flow in the internal iliac. And the question asked what will be the ideal management. I think for this patient, ideal management will be what will be the ideal management for this patient? Iliofemoral bypass. I think this is the right answer. Iliofemoral bypass graft. So this is the right answer. So one angio, not angiogram. I has actually the CT angio was given. I think CT angio diagram. So CT angiography. So next, and the best possible correction, I think this iliofemoral bypass. I think other options were like um, some stenting, or another options was aortofemoral bypass. So these were the other option. I think best possible answer is iliofemoral bypass. Next question asked about procedures of procedure of procedure of examinations in the court, and the question was asked about leading question. In which step leading question is asked? Yes or no question. This is cross examination. The answer is cross examination. Leading question is asked in cross examination. Next, question number 180. Before discussing the question number 180, just tell me one thing, because I am going to discuss the question in the next session. Question number 181. One cadaveric image was given about the nerve supply of the uvula. Just tell me whether it was sensory supply or motor supply. I am confused whether it was sensory supply, because some people are telling it was just supply of this body part, but I think the sensory supply was asked. So the answer will differ according to the form of question. So just tell me, in the anatomy cadaveric image, one arrow is there on the uvula. So just tell me what was the actual question in the comment section. So I will discuss that question in the next video session. So this was question number 80. Paternity different twin babies. What is the diagnosis? So probable diagnosis, I think for this case is superfecundation. Superfecundation. So this is all about question number 161 to the 180. In the next session, we are going to discuss 181 to 200 questions. So we will complete all the questions by tonight. So stay tuned for the next video, and don't forget to subscribe my channel, Dr. Shankar Dey. So thank you very much for watching, and please do comment in the comment section so that I can make the next video as early as possible. Thank you very much.